An important part of keeping your pet healthy is maintaining their dental health. A full dental exam should be done by your veterinarian at your pet's annual checkup if your pet will tolerate it. First, let's talk about the anatomy of a dog and cat's mouth. Adult dogs typically have 42 teeth, and adult cats typically have 30 teeth. There are different types of teeth which serve different purposes. Starting with dogs, the very front teeth are called incisors. These teeth are for grasping, pulling, and self-grooming. There are 3 incisors in each quadrant of the mouth, for a total of 12. Behind the incisors are the canine teeth, sometimes referred to as fang teeth. These teeth are used to puncture and hold. There is 1 canine tooth in each quadrant of the mouth, for a total of 4. Behind the canines are the premolars. These are sharp teeth which are used for shearing. There are 4 in each quadrant, for a total of 16. Finally, behind the premolars are the molars. These are used for chewing and grinding. There are 2 in each quadrant, for a total of 8. Cats have fewer teeth, with a total of 10 premolars and just 4 molars. The portion of your pet's tooth that you can see is just the proverbial tip of the iceberg. There's a lot that goes on beyond the gum line that is very important for dental health. A canine tooth, for example, has a root that is generally a little longer than the actual visible tooth. The roots of the teeth are held in their place in the jawbone by the periodontal ligament. This is a fiber that helps keep the teeth securely in place. If infection makes it past the gum line, this can cause infection and disease of the periodontal ligament, which can lead to loss of bony tissue of the jaw, known as bone loss. When there's no longer enough bone to hold the teeth in place, this can cause loose teeth and extreme pain. The pockets that are created are also a perfect breeding ground for infection. Bacteria which penetrates beyond the gums has a potential to enter the bloodstream and can cause heart disease or kidney disease or other systemic problems. This dental x-ray is normal. You can see that the bone is snug against the teeth. In this x-ray, you can see that there is significant bone loss. These teeth may look okay on the surface, but they're extremely diseased beyond the gum line. This is why it's extremely important to not have your pet's teeth only cleaned cosmetically. Cleaning the visible surface of the tooth is only a very small part of the dental cleaning procedure that veterinarians perform. Their tools are able to clean beyond the gum line, and dental x-rays are imperative to find any hidden issues. Of course, this does not mean it's not important to keep the teeth clean. Keeping tartar from forming can help keep the gums healthy and keep bacteria from proceeding beyond the gum line. You can help keep your pet's teeth clean by brushing them daily. Tartar is the visible debris that you see on the teeth. It's created when the thinner, invisible layer of bacteria, called plaque, hardens. It takes about 24 hours for plaque to harden into tartar, which is why daily brushing is important. Starting your pet young is always best for brushing their teeth, but acclimating a young pet and an older pet to toothbrushing is essentially the same. Start by getting your pet used to having their mouth touched. During play or while relaxing, generally touch around their mouth and face and start to lift their lips to check their teeth. Eventually, you can begin to adjust them to having their teeth touched. Simply lift their lip and touch their teeth with your finger. Slowly introduce the toothbrush. Let them get used to it being near their face before trying to brush. It's best to use a children's or soft toothbrush to avoid damaging the gums. Once you feel your pet is ready, try brushing a few teeth gently with just a wet brush. You may only be able to brush a few teeth, but make sure your pet gets lots of love and praise with any success. When your pet is ready, introduce an enzymatic toothpaste, which is specifically formulated for pets. Do not use a human toothpaste, as these aren't generally safe to swallow. You won't be able to convince your pet to rinse and spit. These toothpastes often come in a variety of flavors that pets love, including poultry or tuna. The actual brushing of the teeth should be done in the same way that you brush your own teeth. The teeth that generally tend to accumulate the most tartar are the canines and the premolars. Focus mostly on the outside surfaces of the teeth. Your pet won't likely allow you to brush the inner surfaces, but it's a bonus if they do. If your pet does not get used to a toothbrush, or you find it difficult, there are some other options. There are small finger brushes available which fit over your finger for brushing. You can also use a piece of medical gauze to gently rub the tooth surfaces. Brushing teeth is not practical for all pets. If you're unable to brush, ask your vet about rinses or special diets which are available to help with dental health. If you notice your pet has any wear, damaged, or cracked teeth, see your vet as soon as possible, as tooth infections can pop up quite quickly. Good dental health can help your pet stay healthy and happy for many years. Subscribe to my YouTube channel for more healthy pet tips.